Hey everybody, Dan here with Pain for You. We had our first snowfall. It's only about 3 inches worth of snow. It's not too bad, but I figure I'll walk out in the backyard and have this little chat with you today. So today I wanted to talk to you about how there's literally no downside to my approach to TMS, or this perceived danger pain. Right? No downside. It's not harmful. It's changing the way we're thinking, changing the way we're feeling our emotions, changing the way we're reacting to the pain. So there's literally no downside. So before I start on that, I'm going to take a couple of nice breaths here. Enjoy the snow scenery behind me. Breathe in the crisp air. It's 29 degrees right now. For those of you out somewhere else where you use Celsius, it's freezing. A couple of degrees below freezing. So breathe in the calmness. Exhale the chaos. Breathe in the fresh air. Exhale the indoor air. Beautiful. So I love it out here. This is awesome. Alright, so there is literally no downside to my approach to TMS, or this perceived danger pain. So why did I say my approach? Well, there's a lot of approaches out there. There's a lot of coaches, a lot of psychotherapists, a lot of doctors, and I'm just gonna make a differentiation between the way I approach it and the way others seem to be approaching it. Because of Dr. Sarno's original theory that it was the repressed emotions that the brain was perceiving as dangerous or a threat, and therefore needing a distraction to something physical like pain to distract us from these emotions, much of the entire TMS focus has been, I gotta go dig up those past emotions, right? And there are cases where that is valid and that helps, and people do get better from doing that. However, I still see plenty of people that are able to get well, resolve their symptoms, without doing a deep dive into their past traumas and their past history and their past emotional experiences. So how is that possible? Still trying to figure it out exactly, but it's possible because maybe it's not only about emotions. Yes, emotions are absolutely a part of it. I tell us every day and all the time. Yes, feeling our emotions, teaching our brain that emotions are safe is terribly important. But it's not the only thing that is going on, right? There are other aspects to recovery that I believe are also equally important. And here's my take. Just clearing off a chair here. My take is this. Sometimes people who find out about TMS are in a real crisis mode. In other words, they're in chaos. They're terrified of what's been happening with their pain or their symptoms. And they're really in a really bad state. Emotionally, mentally, physically, they're in crisis. And if you immediately dive into, well, Sarna thinks it's all the repressed emotions, so I better get out a journal and start journaling about all my past traumas. Well, if you're already in crisis, and now you are reintroducing or inviting these past traumas back into your consciousness, intentionally digging them up and saying, I need to deal with them or release those traumas, that can put a person in crisis a little bit over the top. In other words, that creates more of a perceived danger, and therefore sometimes the symptoms can get worse, the anxiety can get worse. I've heard people say that after a few months of therapy, this one woman learned that she hates her mother. She didn't really think that before, but after digging up the past trauma, she realized all of this TMS is my mother's fault, and I hate my mother. And so, how does that help her feel safer in the moment? I'm not saying those emotions from those past if those emotions are not front and center in your mind, why invite them back in, right? I don't believe we have past emotions. Let me say that again. We don't have past emotions. Any emotions we feel right now. Now, we may have emotions about past experiences, but that doesn't make it a past emotion. I don't think the emotions are dwelling around in our body and waiting for an opportunity to pop out. I think our conscious thinking and bringing up the memory is what reactivates the emotional energy from a past event or trauma. And so I'm not convinced that inviting those past traumas into our house is the best way to feel safer in the present, because again, I believe most of this stuff is all perceived danger. If the brain is perceiving danger from emotions, from movement, from a body that we don't think healed right, or whatever the scenario may be, how is revisiting all of the past traumas of your life the solution to teach your brain that you're safe in the moment? So what's my take on trauma? If it's haunting you on a regular basis, yes, address it, deal with it. There's a lot of people who say trauma is stored in the body. How do we know that? I'm not sure. I'm not a trauma-informed professional. I have not studied trauma deeply, but I just kind of feel like that's an opinion, and I don't know how it's proven. If you know where that's proven and have studies or anything that you can point me to, I'd love to learn, because I don't know everything about trauma. However, for people to say you need to revisit, release, and reframe all your old traumas in order to get better, first of all, what does that look like? How do you know if you've done that successfully? Well, if you still have your pain, you're going to only conclude, well, I haven't done it successfully, I need to focus on my traumas more. In the meanwhile, you're missing out on the joy of the day because you keep on looking in the rearview mirror at everything bad that's ever happened to you. So how do we know when we've gotten it right? And I don't even know what that looks like. And so I guess I'm claiming a lack of knowledge here, which is fine, because if I don't know how trauma works, I don't want to be the guy to point you back and say, go dig in that, because I'm not skilled enough to tell you how to do it safely. So where my approach is different than some of the approaches which tell you to journal about your past and about your past traumas and go to therapy and then revisit your childhood and all that stuff, I'm so much more focused on right now, looking around. Am I safe in the moment? Because it's the right now stuff that I think makes a difference. Feeling safe now in our emotions, in our physical body, in our thinking, in our mental state. Shifting our focus away from the pains towards living your life, doing normal things. That can only have a positive benefit. There's no negative downside to that. Literally no downside, which is the topic here. So I'm not going to tell anybody to go do deep trauma work, because I'm not the expert guide in that. If you feel you need to do that, by all means do that and seek out somebody who can direct you and do that safely. But if you start to go down that path and you feel worse emotionally, mentally, physically, maybe you want to take a break from that for a little bit and focus on right now safety. Am I truly looking around? Am I truly in danger in the moment? Are those past traumas still happening? If so, yes, taking some action steps may be beneficial for you. But if those traumas are from the past, I'd recommend probably putting them down and not ruminating on those past traumas so much and blaming those past traumas for why our life sucks today. I'm not saying you're doing that, but I've spoken to some people who seem to be holding on to past traumas. So the question I'll ask you is, are your past traumas holding on to you? Or are you holding on to your past traumas? I've met people who, at 50 years old, would meet a brand new person out at a restaurant in town, and she would claim, you've got no right to be upset. I was abandoned, meaning she was put up for adoption 50 years ago. And so that is a person who I believe is holding on to their traumas and using it as a justification for why their life sucks today. And I don't believe that's a very beneficial or helpful approach. So back to mind, body, TMS, perceived danger, pain. There's literally no downside to my approach. Get clear on the cause of your pain. Your body's not the cause, right? Accept that that's the case. TMS, mind, body, perceived danger, pain. That's what's going on. Once you've done that, yes, we want to feel emotions, so notice your overall awareness of your emotional state. Notice them, feel them. 1, because it feels good. 2, because it teaches the brain that emotions are safe. It's exposure therapy to emotions. Second thing, be aware of your physical state. If you're carrying tension in your shoulders and your shoulders want to hang out with your earlobes and your breathing is shallow because your chest is all tight, notice that overall physical state. Breathe, relax. Actually reverse it. Relax first so that you can breathe. Notice your mental state. If your mental state is spinning with the catastrophic, fearful, worrying thoughts, you can literally just allow those thoughts to pass instead of grabbing onto them and ruminating on them all day long. Not all of our thoughts are true, and certainly many, if not most of our thoughts are not very helpful, especially if we are in chaos. Let's shift to the mindset. The mindset of indifference is ideal if you can literally go, so what? I hurt today. I've hurt for the past several years. No big deal. Why should I care? Because I know that it's mind, body, perceived danger, pain, that my body's okay, so why am I stressing out about it? Your job is to teach the brain that you're okay. So, indifference is the ideal mindset. If you can't get there, the next best thing is calm reassurance. React calmly to your sensations and symptoms and illnesses. Lastly, stay away from the freak out zone, because the freak out zone screams at your brain and nervous system, oh my God, I'm in danger. And the brain's going to go, got it. We're going to stay up here hyper vigilant, right? And again, lastly, shift your focus back to living your life, doing normal things as much as you can. I recognize that many of us are limited physically due to our conditions. But as you listen to all of those things, accurate knowledge, feel your emotions, the right now stuff, I'm not talking about digging up the horrors of the past. Relax your body so that you can breathe, not taking your own thinking so seriously, staying away from freak out, calmly reassuring, and if ideally you can get there, indifference, and shifting your focus back to life. All of those are teaching the brain that we're actually safe in the moment. All of it. There's literally no downside to that approach. So I've just given you kind of my recipe or my formula or my roadmap all in this one video. Go back, watch again, take notes. These are the core things that I think are really important. I will never tell somebody that it's imperative and required to go dig up your past traumas and invite those ghosts into your house. Because especially for people who are already in crisis, man, that's really going to create some perceived danger, which can only elevate your emotional state, your mental state, and your physical state. So my approach is slightly different than some of the others. The good news is, me and all of the others are on the same page with this one core message that Dr. Sarno had. There's nothing wrong with you. Go live your life. You're not broken, not physically, mentally, or emotionally. So that's my core message for you today. There's literally no downside, and if you are not really sure if it's TMS or not, I told yesterday in yesterday's video about how to do the assessments, but there's zero downside in making a decision that I'm going to teach my brain that I'm okay, so my brain can make a different decision and turn off the warning signal called pain. Does that make sense? I hope it does. So enjoy the snowy scenery. I'm right here by the woods. It's gorgeous. And it's 29 degrees and the wind is kicking. So my cheeks are getting red. So enjoy the scenery. And we will see you tomorrow.